Today we're going to talk about exposure therapy. What is it and why do we use it? So exposure therapy is a CBT technique. CBT meaning cognitive behavioral therapy. But it's a technique that's used in CBT to treat PTSD and phobias. Before I even get into what exposure therapy is, I want to let you know how important it is that you see someone who specializes in exposure therapy. Someone who is trained in it, continues to learn about it, and practices it with clients regularly. And this is because it is so important that they know how to properly do it with you. Otherwise, you can be re-traumatized and actually leave therapy feeling worse. So go ahead, ask to see their resume, ask to see how they got trained, ask who trained them, ask when they last practiced it on a client, ask when they last went to a convention or a talk about it. It's okay to ask those things. I have clients ask all the time about my eating disorder training and DBT training especially. It's okay to ask those questions to make sure that you are in a safe place with this clinician and that they are trained to help you. So exposure therapy works in PTSD and phobias. Obviously, at a clinician's discretion, it can be used to treat other things, but those are the most common. Now in PTSD, it works to help the patient gain control over the fear and pain that may be associated with their trauma. In some cases, flooding is the best option. Flooding meaning putting you right back into that scenario, all the fears and maybe the physical pain, you may have body memories about it, you may feel those. All those come flooding back. And then they help you calm yourself down in this situation itself and help you process through the trauma and feel okay with it. For some people, that's the best option. That's the best way for them to process through it. For other people, they need gradual desensitization. They need to think about the trauma and calm themselves down. They need to imagine themselves going to see that person who traumatized them and calming themselves down. It may be a slower progression, and that's why it's so important to have someone who specializes in it, because they need to be able to tell which is best for you and what will be right in your process as you work through this PTSD. The second reason that they usually use exposure therapy is with regard to phobias. And I'm reading my notes. It says that with regard to phobias, relaxation exercises, imagery, and mindfulness are extremely important. It's so that we can be slowly introduced, like I talked about in the PTSD, where we slowly desensitize ourselves to it. That is the way that this works in phobias. There's no flooding that they do with regard to phobias. They stated that that's usually not the best way to treat that and help you overcome it. The best way is to gradually expose you to the thing that you're most fearful of, and you slowly learn that you have control over that. And they use relaxation techniques, breathing techniques, some do meditation, mindfulness. All of these tools can be helpful in this process. And that's why it's really important for you to work with someone who specializes, because one of the steps that they talked about being really important before doing the phobia work is really installing all of those different options in yourself, being really comfortable with your breathing techniques, being really good at being mindful and meditating, so that you have a bunch of tools to use when you're imagining yourself going back or even physically introducing yourself to a phobia. All of those tools need to be almost like innate, so you can pull them out, you can use them, and you can calm yourself down. So that in a nutshell is what exposure therapy is. And I hope it answers some of those questions that you may have, and maybe why your therapist is requesting that you look into it. It can be so beneficial. So please, if you found this helpful, share this video. You never know who it might help. Someone might be considering it. Maybe someone's therapist brought it up and they're like, ooh, I don't know what that is. You never know who you're gonna help. And if you're new to my channel and you haven't subscribed, click over here. And if you want more information on other types of therapy, click over here, and I will see you next time.